Jithya Suresh, a consultant pediatric dentist at Kinder Hospital, Whitefield. Today I'll be talking about one of the most common dental issues that are seen in children, which is early childhood caries. So starting off with what is early childhood caries? Early childhood caries or ECC basically refers to cavities or decay in kids who are below the age of 6. So these cavities are most often seen in the front teeth of the child. However, they can be seen in the back teeth also. So coming on to what causes cavities in very young kids. One of the most common causes of cavities in young kids are when sugary liquids or food items are left on the tooth surface for a prolonged period of time. What happens is the bacteria in your child's mouth acts on these food items that are stuck on the teeth and produce certain acids which can cause destruction of the tooth material. This eventually results in the formation of a cavity. Because nursing bottle or bottle feeding is the most common cause of early childhood caries is also called as nursing bottle caries. So moving on to how does early childhood caries look, or how does cavity appear in very young kids, babies and in toddlers. So in the initial stages, these cavities are seen as a whitish lesion on the tooth surface. So these are called as white spot lesions in this particular stage, and they might be a little difficult to detect at first. But if they are left undetected and untreated, they soon progress to small brown spots on the tooth surface, and they very soon progress into small cavities on the tooth. So these cavities, again, if they are left untreated, they can progress into bigger cavities reaching up to the inner portion of the tooth, and eventually it can destroy almost all of the tooth surface, and only a small stump will remain right above the gum line. Unfortunately, tooth decay in kids progresses rapidly, and it is also seen that tooth decay in kids is much more common than you can imagine. According to research done by the Center for Disease Control, it is seen that almost 20% of kids who are between the ages of 5 to 11 have at least one untreated decay in their mouth. So how to go about treating these baby teeth? As I previously mentioned, if the cavity or decay is in the first stages, that is, it is in the white spot lesion stage, then it is possible to treat the decay by using certain remineralizing agents such as a fluoride varnish, along with certain improved oral hygiene measures and certain dietary modifications. But if it has already progressed to a state where there is a small cavity or a hole in your child's mouth, then we may need to do something like a simple dental filling in order to treat it. However, if the cavity has become progressed to the inner layers, that is, the cavity has become deep and it has reached the inner nerve fill layer of the tooth, then we may need to go ahead with something like a pediatric root canal treatment, which is called as a pulpectomy or a pulpotomy procedure, which is followed by placement of a cap or a crown on that particular tooth. But some teeth which have gone beyond the point by which we can save it with a pediatric root canal may need to be extracted, followed by the placement of something we call a space maintainer. So the space maintainer is basically an appliance which holds the space of that particular tooth until the time the permanent teeth erupts in its place. So all of these treatments can be treated by two broad ways. The first, of course, is on treating the child on the dental chair. However, if the child is extremely uncooperative and is not able to cooperate at all on the dental chair, then we have the option here at Kinder Hospital to treat the kid under general anesthesia. Moving on to why it is important to treat these baby teeth. So one of the most common questions I get asked as a pediatric dentist is that these teeth are anyway going to fall out eventually. Do we really need to treat them? The answer is that yes, it is extremely important to treat these milk teeth even though they are going to fall out at some point, because they may result in certain medical emergencies if they are left untreated. So one of the most obvious adverse effect of leaving untreated cavities is toothache and pain. which can sometimes be so severe that it can affect the child's ability to eat, and it can also hamper with your child's sleep at night. And these cavities, again, if they are left untreated and it has reached the inner nerve field layer, it can lead to pus collection within the tooth, and it will eventually be seen as a boil or a pimple in the gums. And this can progress to something more severe like a facial swelling or cellulitis, which may eventually become a medical emergency. So we'll just look at a few simple ways which we can, you as a parent can follow in order to prevent your child from getting early childhood caries. The first and the most important one is to not put your child to bed with a bottle of milk, juice, or formula. Also, make sure to restrict the bottle feeding time along with the meals, and also ensure that you're not giving the child pacifiers which are dipped in sweetened liquids. Also, start adopting a healthier, balanced food or a balanced diet for your child, which restricts the intake of sugary food and liquids. Another very important and often overlooked very important preventive step is to make sure that you start cleaning your infant's oral cavity, that is your infant's gums, even before the first teeth erupts. All you have to do is take a cloth, dip it in some water, and wipe the gum pads of your child. And as soon as the first tooth erupts, you should introduce a toothbrush to your child and make sure you're brushing the teeth twice daily. And also make sure that you yourself are performing the act of toothbrushing until the child turns 6 years of age. Lastly and most importantly, make sure you get your child to a pediatric dentist for a early dental evaluation. The pediatric dentist can check the oral cavity of your child and give certain preventive measures that could be specific for your child. This will ensure a lifetime of good oral health. Also, a periodic recall of 3 to 6 months and a regular dental checkup will also ensure that your child remains orally fit. You may visit us at Kinder Hospital, Whitefield, for a complete dental checkup and to learn more about